Welcome to your SilverScript Employer Prescription Drug Program sponsored by the Group Insurance Commission. SilverScript makes sure you have access to affordable medication when and where you need it. You've probably heard of CVS Pharmacy, Minute Clinic, and CVS Health Hub. We're all part of the CVS Health family working together to help you on your path to better health. SilverScript manages your prescription benefit plan like your health insurance company manages your health benefits. We work with the Group Insurance Commission to determine what medications are covered, what they will cost, and where prescriptions can be filled. SilverScript provides tools and services to help you stay on track with your medications and take care of your health. 2023 SilverScript copays. Good news! No copay changes from 2022. There is still no annual deductible and no separate premium for your SilverScript plan. The SilverScript copay structure is as follows. For a preferred retail network pharmacy, a Tier 1 or a generic drug, you will pay up to $10 for a 30-day supply and up to $25 for a 90-day supply. For a Tier 2 or a preferred brand, you would pay up to $30 for a 30-day supply and up to $75 for a 90-day supply. For a Tier 3 or a non-preferred brand at a preferred retail network pharmacy, you would pay up to $65 for a 30-day supply and up to $165 for a 90-day supply. Filling your prescriptions at a CVS Caremark mail order pharmacy, a Tier 1 or generic drug, you will pay up to $25 for a 90-day supply. For a Tier 2 preferred brand, you will pay up to $75 for a 90-day supply. And for a Tier 3 non-preferred brand, you would pay up to $165 for a 90-day supply at CVS Mail. For non-preferred retail network pharmacies, these pharmacies include Walmart, Walgreens, Stop & Shop, or over 65,000 other non-preferred retail network pharmacies across the country. For a Tier 1, a generic drug, you would pay up to $10 for a 30-day supply and up to $30 for a 90-day supply. For a Tier 2 or preferred brand drug at our non-preferred retail pharmacy, you would pay up to $30 for a 30-day supply and up to $90 for a 90-day supply. And for the Tier 3 non-preferred brands, you would pay up to $65 for a 30-day supply and up to $195 for a 90-day supply. More information on these copay structures may be found at www.gic.silverscript.com. Your 2023 GIC SilverScript prescription benefit offers you the convenience of maintenance choice. With maintenance choice, medications you take regularly, such as diabetes, asthma, or high blood pressure medications, can be filled in 90-day supplies at CVS Pharmacy or through CVS Caremark Mail Service Pharmacy. You can choose pickup or RX delivery by mail. Either way, the cost is the same. 90-day supplies are more convenient and usually cost less. Just contact SilverScript Customer Care to have your prescriptions transferred to a mail order pharmacy. Here are some helpful terms you should know. Deductible. An individual or family needs to spend this amount on medications each plan year before coverage starts. May be combined with medical benefits. Just a reminder, your GIC SilverScript plan does not have a deductible. Maximum out-of-pocket, or MOOP. Once you or your family reach this amount, all medications are covered at 100%. And just like deductible, the GIC SilverScript plan does not have a maximum out-of-pocket or MOOP. Generic medication has the same active ingredients as the brand name medication, usually your lowest cost option. Preferred brand medication, medications that will cost less under your benefit plan. Non-preferred brand medication, highest cost option under your benefit plan. Maintenance or long-term medication, medication you take regularly like high blood pressure, diabetes, or high cholesterol medications. Here are some terms and ways to manage your medication. Some medications require you to take additional steps or receive additional approvals before they are covered under your plan. These could include quantity limit, a limit on the amount of medications your plan will cover. You can continue to fill prescriptions after you've reached the limit, but you'll be responsible for any additional costs. Step therapy. For many conditions, more than one therapeutically equivalent medication option is available, and your plan may choose one medication as the preferred option. Step therapy means you need to try the preferred option first. If it works for you, you can continue to take it and may save money. If not, non-preferred medications will be covered. Prior authorization. This means we need more information on why your doctor has prescribed a specific medication for you. CVS Caremark reviews this information and determines whether or not your medication will be covered by your plan. Dispense as written. If your doctor indicates dispense as written on your prescription, your pharmacy can't substitute a generic for a brand name medication, and you may have to pay more for the brand. Appeals. If we deny your or your doctor's request for coverage of a non-covered medication, you have the right to appeal that decision. For more information on these topics, please go to your summary plan description, also known as SPD. Use the Check Drug Costs and Coverage tool at caremark.com to find out what medications are covered, if there are extra requirements for coverage, and how much they will cost. Remember, medications are only covered when you fill your prescriptions at a network pharmacy. Find pharmacies near you with the pharmacy locator at caremark.com. Register at caremark.com to manage your Medicare prescription drug plan. Everything you need to manage your medications anytime, anywhere are on caremark.com and the CVS Caremark app. Information can also be found on www.gic.silverscript.com. Registering at caremark.com is easy if you already have prescription benefits with SilverScript. You can register at any time using your member ID. That's the number on your ID card. Remember, you won't see any copay changes for the upcoming 2023 plan year. If you're new to SilverScript prescription benefits, you can register when you receive your member documentation in the mail with your member ID card. Contacting SilverScript. Your GIC SilverScript dedicated customer care team can be reached at 1-877-876-7214. TTY users should call 711. Representatives are available 24 hours a day, 7 days a week. Please contact SilverScript customer care if you have any questions about Medicare Part D, SilverScript, drugs on the SilverScript formulary, drugs covered through the additional coverage provided by the GIC, network pharmacies, and any other prescription drug information you have received from the plan. Welcome to your SilverScript Employer Prescription Drug Plan, sponsored by the GIC, the Group Insurance Commission. We look forward to serving your prescription drug needs. Thank you.